Hey guys, today I'm going to be giving you a few tips that you can use at home to help rib joint strains. Rib joint strains are surprisingly common. They typically happen when the arm is used in a weird and awkward way, either acutely, so it happens quickly, or repeatedly over time. So examples might be if a dog pulls on a lead, or if you have to lift something big and awkward and wide, or if you just sit leaning on an elbow, driving with a bad posture for a while, or I've even treated people where holding a baby for a long period of time just drags through the arm, and it just puts some tension through the connective tissues from the shoulder to the thorax and can strain. Plenty of other examples like whiplashes and things can cause them, but typically what they feel like is that there might be some sharp pain around the shoulder blade. I mean, our thorax goes just from underneath our collarbone, so our top rib is very high, and it runs all the way down to, you can probably feel your lowest rib in your flank. So you could have pain anywhere along there, but typically it would cause sharpish pain around the back, sometimes pain coming around the side, even into the sternum and the chest. It can feel like it's hard to breathe. Obviously, there are lots of other things that can make you short of breath, so if you are ever worried about shortness of breath, always chat to a doctor. But rib joint strains and intercostal strains can also cause shortness of breath, or at least pain on breathing and pain on coughing and things. So what I'll be running through today can help you at home if you can't get in to see your trusty osteopath. So first of all, you can beat up the local muscles. So grab a massage ball, a tennis ball, or a lacrosse ball, or one of these little spiky balls. If you're really acute, you might just want to do this leaning back against a wall, where you can get the ball between your shoulder blade and your spine. So you're going to work on whatever feels tender all around your back, between the shoulder blade and the spine. Push some pressure back on the wall, or you can lay down onto the floor and put some pressure onto the tender point. You'll know you're on the right place because whatever hurts is the best bit. And then once you're there, move your arm around. So you're using shoulder blade movement to direct the tension into the right place, so you can take your arm up and out to the side, across your body. It'll feel pretty tender, but nice tender. You can also just wriggle around. So this is true whether you're leaning against a wall or if you're laying down on it. Just gently wriggle and move, and beat up the tissues a little bit just using a ball. The other thing I like to do is drive motion through the thorax using the head. So the way I go about that is to sit in a rocking position. Now, it's sometimes a bit tricky to mobilize the mid-back because compared to other areas of your body, it's not actually that mobile. So if you've got restriction in your mid-back, your body is going to want to cheat and start moving through the lower back and hips more if, say, you're trying to mobilize from a standing position. So I take the hips and the lower back out of the equation, relatively speaking, by sitting in this wide kneeling position, hands out in front. So now any movement I do with my head is fairly blocked from being transferred down to my hips and lower back, because I've used up all that motion by sitting in this weird position. So now if I move my head in all three planes of motion, so thinking about forwards, backwards, side to side, really let that movement ripple through the spine, and then rotation as well, and even just little head circles both ways, really exaggerating the movement of the thorax and shoulder blades. That's a nice way to mobilize the rib joints and upper back. So I like to think of spinal waves. Think of my spine being a wave, or kind of a rope that I'm trying to flow and whip, and using head movement to drive that whip. The other thing, while you're here, really try and pay attention to and feel your shoulder blades gliding over your rib cage. So moving the head, moving the shoulder blades, just wriggling a lot. I call it unsticking. Wriggling is unsticking the connective tissues from your shoulder blades through to your thorax. While you're here, I'm just going to make a small adjustment, actually, not go quite so wide with the knees. You can stretch. So say I had a rib joint strain on the left, you'll probably end up with some tightness through your lats. So gently stretch and wriggle just that left side by taking the left hand across your body and wriggling and moving around. You might want to add some rotation by twisting this other hand underneath. Something I haven't said is that with all of this stuff, rib joints strains, they can be really acute, really causing quite sharp pain. You don't want to bash through that barrier of pain. So all of this stuff with an acute rib strain, you'll find some of those directions of movement will meet pain, some won't. So you want to work more into the directions of movement that don't cause pain. So add as much pain-free movement as you can, and then say you're going through a direction of movement that just about meets some pain, that's where you stop. So even though you could go further, you could push through that barrier, you don't push through the sharp pain, you just meet it and then back off, meet the pain, back off. What you'll find is the more you do it, the further that barrier of pain gets away, so you'll gradually creep into it. Then the final thing I do is hang from a door frame. So hold onto a door frame, push your thorax back. So this you could do standing up. Hold onto a door frame, lean back, and again use a little bit of head movement, a little bit of thorax movement. Sometimes I say imagine a torch is coming out your sternum and you're trying to shine that torch in different directions. So hang back from that door frame, shine the imaginary torch, use the head nods and head twists just to direct some force. Depending on how high the rib joint strain is on your back, depends on how high you'd want the hand. So sometimes for a high one, you might want your hand low and push back, and then vice versa. For a low rib joint strain, you might want your hand high to get the tension to where you need it to be. But basically all you want to be doing is loosening the muscles, stretching the muscles, mobilizing the thorax, and be patient, because rib joints, they do get better. They typically get better fairly quickly actually compared to other injuries, but the way they get better is with movement and stretching and being relaxed. Don't panic, because tension will tighten up the thorax. So just relax, understand that it's going to take a few days, maybe a couple of weeks to feel completely back to normal, but by staying mobile and stretching everything through, it's something that should get better. And obviously if you can get in to see someone like an osteopath, then that's great, but right now we're in isolation, so we can't help, so this is the best I can do. So if you have any questions, comment below.